This is NDTV. And you're watching NDTV Hindu.
Hello again. Over the recent years, there's been so much increased sporting activity in our country. Football, hockey, cricket, volleyball, basketball, tennis, squash, just to name a few. And every single sports person who indulges in any form of sport, whether it's professional or amateur, finally does need the help of a sports medicine doctor. And to this end, we decided that we'd kind of take a look at sports medicine as it exists in India today. My guest today is Dr. Kannan Pugazhendi. Now, he's a sports medicine specialist, and he has 5 clinics, 3 here in Chennai City, 1 in Bangalore, and 1 in Coimbatore. And so we're going to catch up with him and try to find out what this is all about. Thank you so much, Dr. Kannan, for being with us today. Now, let's first of all talk broadly about what sports medicine actually entails. What's the gamut that it covers?
As normally people feel, sports medicine is not just about sports injury management. It talks a lot about how the healthy population is kept healthy. In other words, you do not reach a hospital prematurely, and that is why a sports medicine center should function. But the limelight of that sports medicine comes from the sporting injuries, because that is what we see very often publicized.
And we read and hear about that all the time.
But when it comes to sports medicine, we are not treating illness so much, but we are trying to maintain the wellness of the people. But we do deal with the what we call as morbidity. That is to say, there are injuries which need corrections, which require assistance so that they can return back to their normal life with the best of their potentials.
Right. But would you actually look at sports persons, not when they are injured or in anything like that, do they actually have to come in to see you when, just to keep fit and just to sort of keep themselves going, keep themselves in peak condition?
Perfect. I do that. In the sense that the players who reach out to me are into prehabilitation. That is to say, they want to prevent injuries, and they need to know how their body could lead on to injuries because of their structure or because of a specific function that they repeatedly do. For example, a tennis serve or a basketball or set shots. So many things that they do specifically, they may require assistance before they get injured. So a sports medicine doctor is a requirement for them in assessing them, what we call as pre-participation assessment.
Right. What's the difference then between a sports clinic and a regular gym? Is there
a sports medicine center does not have the idea of getting everybody into a center and get them to exercise.
Okay.
But we do have patients who want to come back to be normal, exercising as much as the others, and would like to reach a certain level of fitness for them to appreciate themselves more. And say, for example, some of them would like to go to the Himalayan base camp. In those kind of conditions, that they want to know, can I go for this Everest base camp? Climb. And so they come to me with these kind of ideas and dreams. I encourage them to ensure that we reach that kind of a potential, and they will not be in any problem when they reach that base. In fact, there were people who are going to Kilimanjaro, a very important space in Africa, and the whole team had landed, and we had trained them, and all of them except the person who didn't train reached the top of the mountain.
Right.
To be very specific.
Okay. Well, Dr. Kannan, you look in amazingly good shape. I mean, you look like you'd get to the Everest, to the peak of Everest tomorrow if we let you go. but you have a lot of very well-known people who actually come in here. I don't know if it would be confidential for you to tell me who those people are.
I have the Indian team football captain, Baichung. Baichung Bhutia, a very good player of very good repute, and very few Indians have reached his caliber. I do see him here for his fitness, for his assessments, as well as injury management. And we are assisting him in his new academy that's being happening in Sikkim, which he's starting. At the same time, I have the Indian basketball team captain, who is Mr. Robinson, and we train with him also. And we do have cine stars who come in for support. We have had Surya, or we have had various like Vishal and Mr. Arya, because they come in a shoot that they are injured and they have to continue to shoot.
Okay.
And they are also requiring a specific amount of fitness to be able to do what they are expected to do.
We understand also that our national chess champion Vishwanathan Anand also comes in here. Now what would he come in here for? Is it to keep him mentally fit? How is
I
that?
never enter into that aspect of Mr. Vishwanathan Anand, because he is so good at it that he doesn't require amazing.
Right.
But what we require, what he requires as support would be his fitness, wherein he doesn't find the time to give for fitness. So we have to understand his requirement and the time available, and prescribe the exercises such that he will be able to get the best of it, and still not be having a back pain or a knee pain, which a person of his caliber should not have.
Right. Is it necessary for all of these celebrities whom you have on your rolls to be coming in here? Do you ever need to go to them?
It depends. Certain times I do see them in their environment. For example, a football player, I may have to see in his environment for his requirement. So I may go, but otherwise I prefer them in my place, where I can assist them with whatever gadgets that I have. And with my team of nutritionists, physiotherapists, trainers, I would be able to assist them better.
Right. But talking about gadgets, you just took me around your place here. I didn't see a great deal of gadgets. I'm just wondering, where does this happen? Is there an area I haven't seen in here?
There's a major misconception that there must be a lot of gadgets to treat people. In my 25 years of practice, I have not invested on any form of gadgets that could heal people.
There's nothing expensive or flashy right here.
There's a normal ultrasound and IFT, which are not very costly equipments. We do use one is called as the Pulsetron, which is a magnetotherapy unit. That's the maximum I've invested. But most of our work comes from our hands. We use what is called as a myofascial trigger points.
Tell me that again, Doctor.
Myofascial trigger points.
Right.
These myofascial triggers happen in the body whenever muscle is used beyond its capacity, stretched beyond its capacity, or overworked. And this is what commonly people do it in a sporting arena, or even people who work in the kitchen to reach out for a vessel or something above their head. They may stretch their muscle beyond their capacity and have a myofascial trigger. This myofascial trigger was introduced to the world specifically by Janet Travels, who was the physician for John F. Kennedy when he was running the president.
He always had a very bad back, right?
Sure. And this guy couldn't sort of stand until Janet Travell came into the picture and made sure that he could go through his presidential election scenario, and made sure that he was in the best of his.
Right. And of course, she ended up after that becoming the White House physician for many presidents, right, Doctor?
Yeah. And she was able to give a book, which was the major book even today. That's the Bible for myofascial trigger.
Right. I'm going to ask you to hold on for just a short while. We'll take a very short break, but when we come back, we'll go into some other aspects that relate to sports medicine. Don't go anywhere. We'll be right back with you. Welcome back to our program. You've joined us here on We Connect as we're chatting with Dr. Kannan Pugazhendi. He's a sports medicine specialist. Thank you so much, Doctor, once again for staying with us. Is sports medicine popular in India?
It is now popular in India because people hear the word sports as a career. Until then, it is not possible for sports medicine to be a specialization.
So how did you become a sports medicine specialist then? Why did you become really?
It was my passion to be a sportsman. I wanted to represent our country. I saw Jesse Owens' 1936 Berlin Olympics, that is to say the return of Jesse to Berlin. So I was so motivated to run. So I was running regularly. But unfortunately, when I entered the medical college, it was not possible to
No
pursue.
time.
It's not possible with a 7 o'clock OP and
Yes.
till 8 o'clock we work late. But I continue to have my passion for sport, and I was obsessed with medicine once I entered the college. So mixing a passion and obsession was the best thing that could happen.
Right. So this was the next best step for you, right? So you're very much right there in the middle of all the action, right? Do you see a future for sports medicine, having said what you've just said to me?
We are still not started any work on sports medicine because the medical colleges have to recognize sports medicine as a subject or as a curriculum. We don't have specialists in our country yet. Those who have completed sports medicine are very, very, very few.
Really?
Yeah.
Why do you think it is
Who's
not
going to
popular?
pay them?
Ah, okay.
Where is the
it's
money
not
gonna
it's not a
come
good
from?
money-making thing for a doctor.
Yeah, basically, where any profession, we need to have the money to continue to do it. But when I started off, I was located at the YMCA College of Physical Education, where I was taking up the sports school where children didn't have support of any kind of injury that they had. I used to take them to the medical college and bring them back.
Okay.
And they said they had put a cast for a sprain. I had the best of the orthopedicians see them. But when they came back the next day, they cut open the cast, tie a crepe bandage, and they were running. So I realized what they wanted and what we are doing is not
Doesn't match up
at
really.
all. So I started learning more about sports medicine. And this coach who was sitting down there by name Mr. Ravanan asked me to see any injury in the sporting arena. Said, you fix it. So I had no other go. I have to find some way to fix something like this where I didn't have experience. By 84 when I joined, by around 87 I knew what to do. And by 89 I was with the Indian cricket team, accompanying them for the West Indies tour. And I had the best of the opportunity to learn what was happening at that level of competition. And following that, it was at the 1996 Atlanta Olympics, I met the best of the guy whom I should say India should use as a coach for hockey. And that is Cedric D'Souza. And this was a man who taught me how to love country. There's nobody, I think, who is well versed in hockey as much as him, and the passion for sport, the love he had for his players, phenomenal.
Right. But now you're saying that there are not too many sports medicine specialists in India. I do know that at the recently held Commonwealth Games, there were 325 doctors and not a single sports medicine specialist. How in the world could you conduct an international sporting event like that without a sports medicine specialist? Is this correct information that we have?
Definitely there were no sports medicine doctors that are made available.
Isn't that a disgrace?
Definitely. There's no doubt about it, because even when we had this Commonwealth, the SAF games here, at that time they wanted to know how we could manage it. So the then government had called me to find out how we can run programs for a short while to prepare the doctors for this event. So just placing a cardiologist or an orthopedic surgeon would not do the trick. We have to have sports medicine people trained for that particular activity, taking up this. Unfortunately, in our country, we don't give importance to sport, and we don't give importance to sportsmen and women who give their blood and sweat for the honor of the country.
That's true.
So it's a major disgrace when we find that we don't take care of them. Their security is threatened. When they are injured, where do they go? So they don't actually give out their best, perhaps.
Right. And then, of course, we crib that we have 1 billion people and we have no champions. We're not encouraging really champions to be bred here in our country in that respect. You have 25 years of experience. Now you tell me, are you training any other young people to, to do what you are doing?
Actually, sports medicine is about a team of people. It is not about an individual.
Oh, really? Okay.
So sports medicine is one specialty which needs exercise physiologists, which needs biomechanists, which needs sports nutritionists, sports psychologists, sports biochemistry, sports pharmacology. So it requires a lot of people getting involved with it. Abroad, this is a major thing happening. In our country, there are very, very few people involved in sports itself. Today, the IPL has gathered so much of attention, and people want to be there because of the important things that can happen through it, money especially.
Yeah.
But still, the capacity of the individuals who can take care of the injuries is not as good as we could have preferred. We should definitely